Hello, everyone. Hi, Yari. How are you? So it's about time, so I'll just get started with the meeting. First of all, thank you very much for joining the meeting or the session. Much appreciated. Some of the people have called me and I've told them that if they are not able to attend this, I'm already attending, recording this session, and I'll share the recording with them. Also, if you have already downloaded and tested the app, then you do not necessarily need to be a part of this meeting. You'll just let me know so that I could intimate Flinders University, and then someone from Flinders University is going to reach out to you for evaluation and feedback. All right, so without further ado, let me formally start the presentation. If you have any questions, kindly message them in the chat box. As soon as I'm done with the presentation, it's not too long, then we can address them individually. Although it is a 1-hour session, but I'm assuming that or hoping that within 15 to 20 minutes, we will be done with this session and it goes smoothly. Anyways, I'll just share my screen. So can you guys see my presentation now? Is it visible? All right, all good. All right, so a quick introduction to GP Partners Australia. So GP Partners Australia is a South Australia-based organization. We are about 22 years old, and we are in the area of primary healthcare training and education. For the last 22 years, we have been running a couple of shared care programs. We have run a mental health shared care program, palliative shared care program, and obstetrics shared care program. So what the shared care program is that basically we try to work with the specialists and train our GPs so that the patients could be kept outside the hospital as much as possible, and the GPs could be trained and supported so that the patients could be treated and supported inside the community. So we run this project from Digital Health Agency, Australia Digital Health Agency, which basically has sponsored and runs and manages My Health Record. About 2 years ago, we won this grant from them. And the aim of this project was to test advanced care directives. Quick introduction to my team today. So my name is Atif Majid. I am the Program Manager, Technology and Startups at GP Partners Australia. My colleague, who I am assuming would join me as well, is Lian Ma. She is the Program Manager for Shared Care. Her email address is also mentioned there. And also we have Jari Jorgensen with us. He is the tech lead of this project. He is the person who designed the wireframes and implemented the project for us. And also, if you have any technical questions or queries, you could contact to him, or you could contact me. Either way, we'll reach out to him, and we'll hopefully make sure that we'll be able to address your queries. By the way, Yari, I got this picture of yours from LinkedIn. So in case you want this updated, please feel free to do that. Before we begin, I emailed you already the consent and information sheets. So I will just quickly go through those sheets again, just to make sure that we cover the basics over here. So basically, this is the consent form that I emailed earlier. It mainly states that, and I'm assuming that you have read it and you have agreed to it, that you are over 18 years of age, you have read all the information, you're free to retain a copy of the information sheet and consent form. The participation in this survey is entirely voluntary, and you can withdraw at any point that you may want. And you also acknowledge and understand that you can say whatever you want to say in your feedback about this app. This is not going to affect any of the consequences, and the researchers of the Flinders University are going to independently reach out to you for your feedback, and that will not be communicated to us. So what we will get will be a de-identified cumulative research response, not anybody's individual response. So please feel free to share your heart and mind whenever the Flinders University reaches out to you. Let us know everything, whether you like the app, you hate the app, any positive or negative feedback about that would be much appreciated. I will quickly go through the information sheet for the ACDCare app. So ACDCare app basically was designed to communicate and securely share information with patients and other care providers for advanced care directives in order to avoid hospital care transfers, admissions, and duplication of services. The purpose of the study is, like I said, to collect your thoughts on the ACDCare app and any feedback that you have, whether you find the app helpful or difficult to use or whatever, just let us know. Any feedback that you provide us will help us to improve the app for future rollouts. You would be reached out for an online survey. This survey would be through a telephone conversation, so a phone interview. So the staff of the Flinders University will reach out to you within this week, hopefully, and we'll schedule a time, and it will not take more than 10 to 15 minutes to gather your thoughts on that. Once you have done that, just let us know, and after that, I'll contact with the GP Partners accounts, and we will make the direct transfer to your bank account as a thankful note to participate in the survey for us. Also, if you are interested, we can email you the findings of the evaluation as well, which will be published by mid-April. Right, so that was a little bit of housekeeping, and now I will switch back to my presentation. All right, so hopefully you can see my PowerPoint presentation on your screens now. And now I will quickly run through the ACDCare project. So the ACDCare project, the inclusion criteria for you to be able to participate is that you are a South Australian resident, because the way the advanced care directives work in Australia, every state and every territory have their own versions of advanced care directives. This particular app is designed for South Australian and Northern Territory region only. So in order to participate in this evaluation survey, you have to be a South Australian resident. You have to be 18 years plus of age. You have to have a decision-making capacity. You have to have digital skills. And by digital skills, I mean you should be able to go online, download an app, and use it and play with it so that you could let us know your feedback about it. You should be proficient in English. In future versions, we are planning to roll this app out in different languages, but for the first version, it's only in English. So you should be able to understand, be proficient in English language, and be able to communicate your wishes to the app in English language. The exclusion criteria is only one, that you are unable to participate for any reason. So basically, what is advanced care planning? Advanced care planning is basically planning ahead for your future health. Because the reason we have advanced care directives is that an accident can happen, an illness can happen at any age and at any stage of your life. And if that happens, then we may not be able to make our own decisions. So advanced care directives are for those specific situations where we would want to have a say, but we are not able to communicate our say or our wishes. So in order to address that problem, all states and territories in Australia have a legal document, and that document is called an Advanced Care Directive, or in short, an ACD. So in Advanced Care Directive, it's basically a very simple document, and in which you mention what is important to you about your life, about your health, and about your choices. What matters to you, where you would want to prefer to live or be cared for, and what are the outcomes of care that you would want to live with or you would not want to live with, and what healthcare would you want, and what healthcare do you not want. Also, you, in situation where you're not able to communicate your choices to your healthcare providers, you can appoint people who in your place can communicate your wishes. And those people are called substitute decision makers, or in short, SDMs. So you can mention the contact information of these SDMs also in your advanced care directive. So advanced care, the substitute decision makers are basically the people you appoint who you trust could make decisions on your behalf in a situation where or unfortunate circumstances in which you are not able to do that. So in this way, everyone will know what you want in advance. And in this way, the benefit of having an advanced care directive filled out is that you can control what happens to you. And this is basically giving a legal voice to your wishes. Also, it's advanced care directive is not a static document. It's a voluntary ongoing process. And by that, I mean is that once you have filled out your advanced care directive, you can upload it into your My Health record. Whenever it is needed, somebody could access your advanced care directive by going through your My Health record. And they then can also not only learn about those wishes, they could also reach out to your substitute decision makers and help make choices and decisions about your future health. It is an ongoing process, like I said. So at any time, if you think, you feel you have changed your mind, you want to update your document, you can always go back and you can always update it, have it witness signed and uploaded on My Health record. And this way it becomes a kind of a living will, if you may. We have a small video for advanced care directives introduction. I'll just play it for you on my YouTube.
My name is Leanne, and I'm the manager of the GP Palliative Shared Care Program in South Australia. The GP Palliative Shared Care Program, administered by GP Partners Australia for SA Health, supports GPs in caring for their patients who are facing a progressive, life-limiting illness and providing shared care with public specialist palliative care services and other key stakeholders. COVID-19 has completely disrupted our way of life, taken lives and loved ones, and disproportionately impacted those in our communities who are most vulnerable and disadvantaged. But as much as we're in uncharted waters, the reality is that we are also learning more about our new normal with each passing day. We're about to commence a project we have named the ACDCare project, and it's all about advanced care planning. Significantly, that is completing an advanced care directive, which after all is all our responsibility, and completing a 7-step resuscitation pathway, a healthcare provider's responsibility, such as your GP. The aim is to complete this via our ACDCare app, which will allow these documents to be stored, uploaded to My Health record, and be readily available when needed by all who will be invested in your care. Advanced care planning is and should be a routine part of a person's healthcare. When a person's values are discussed openly, their healthcare preferences can be respected at a time when that person can't voice their decisions themselves. It's an ongoing process that needs cooperation between individuals, their families, care workers, and health professionals alike, as well as community organisations and healthcare organisations such as ambulance services and hospitals. It may be revised over time, as inevitably things do change, our future care preferences and our wishes will change. What is an advanced care directive? An advanced care directive is sometimes known as a living will. It is written by the person themselves. An advanced care directive is a written record of your preferences for future care. The directive can record your values, life goals, and preferred outcomes, or directions about future care and treatment. Advanced care directives can also formally appoint one substitute decision maker or more. In Australia, advanced care directives do differ between states and territories. Our project will develop a process using a purpose-built app, ACDCare, that will enable you to complete an advanced care directive in just 7 steps. Your GP then can complete a 7-step resuscitation pathway, which is an additional guideline for health professionals to further ensure that a person's wishes are met, and that puts everyone on the same page at a time they need to be. 7 steps, that's all it takes. Step 1, think about what is important to you, your values, your beliefs, and what you understand about medical care that may be applicable to you in the future. What treatments would you consent to, and those that you've decided that you wouldn't. Step 2, research what options you have. What are the different medical interventions or procedures, and how may these affect you? Step 3, appoint your substitute decision maker, or you may wish to appoint 2 or more substitute decision makers. That's fine. Someone who is willing and able to speak for you if you're unable to speak for yourself. Someone who will think for you as though they were actually standing in your shoes. Someone who will see things as you do. Someone you trust. Step 4, discuss. Talk about your wishes and your plans with your substitute decision maker, your family, your loved ones, and importantly, your doctor. Step 5, record your plans and complete your advanced care directive via our ACDCare app. That's important. Step 6, print, sign, witness, and upload your advanced care directive to My Health Record. Our app can do all of this for you, and during our project, we will be there to help you complete this process every step of the way. Finally, step 7, encourage your doctor to complete a 7-step resuscitation pathway so that all your healthcare providers will be on the same page at a time that they need to be for you. Thank you.
Right. Plus apologies for this a little technical glitch. This video is available on the YouTube, publicly available. So what I will do is I can share the link with you guys as well if you need it, or if you just want to view it again, just let me know. Also, this project was, this video was designed a couple of months back, and back then we did not anticipate that the participants will have only a couple of days to be able to go through the whole process and then provide the evaluation. Therefore, for the purposes of a evaluation, you are not required to actually print and sign and witness the document and then fill out the 7-step research pathway as well. You're most welcome to do that. But if you are just able to download the app, use it and play with it, and then let us know, and then we'll contact the Flinders Uni and they'll reach out to you for the purposes of evaluation. That would be sufficient for the purposes, again, of this evaluation. However, you are more than welcome to go through the whole process. Once you have completed your advanced care directive, like it was said in the video, you would a PDF would be generated. You can print out that PDF file. You'll need to sign it, have it witnessed, and then scan it and then push it back in My Health Record. And also you can share it with your GP, who would then fill out the 7-step research pathway. You're more than welcome to do that, and the app is capable of doing that. However, like I said, at this stage for our evaluation, we just required you to download the app and to sign up and use it, and that would be sufficient. Right, I'll move ahead with the presentation. It's just a little bit of repetition again. I'll just, like they were mentioned in the app, in the video, is just explaining how you'll flow through the whole process. So the app is available both on the Play Store as well as an App Store. You just need to type ACDCare. These are not 2 words, it's just 1 word, ACDCare. Once you type it in, you'll be able to find the app, download the app and sign up. Once you sign up, you would be able to see multiple options over here. Right now, we are interested only in advanced care directive. Please also make sure that you sign up as a South Australian resident, not as a Northern Territorian. Once you do that, then you go to the advanced care directive. All of these options will appear to you. What is important to you? Outcome of care, healthcare you prefer, where you wish to live, other personal arrangement, refusal of healthcare, your substitute decision makers. Once you fill out all of that information, then the app will be able to generate this PDF document. based on all of the information that you've put into the app. And this is the official legal advanced care directive form that will have all the information that you've just entered into this PDF file. And the evaluation process, for the purpose of evaluation, it ends here. However, like I said, you're more than welcome to proceed further. If you do decide to move further, then you will need to have it signed and witnessed. And also you can take the same document to your GP, and the GP can fill up the 7-step resource plan as well. But again, these are all options steps. Once you have done all of that, our app is capable of taking a photo of the documents and then pushing it into your MyGov account. However, due to a limitation by My Health Record, what you would actually need to do is you need to scan the signed document, and using a desktop, then you can push it through using your MyGov account into your My Health Record. Once you go to your My Health Record, there will be a section over there saying Advanced Care Directive, and you can upload the file over there. The good thing about this app is it can retain multiple versions of your advanced care directives. We can maintain and retain at least 3 versions of your advanced care directives, as well as your 7-step pathways. Therefore, at any point, you can go back and edit the document if you change your mind, and have your advanced care directive updated accordingly. And that's pretty much it. So the steps are, we're hoping that within a day or 2, you would be able to complete all of these steps. Once you do that, just let me know that you have completed all of the steps and you are now ready to give your feedback about the app. And then just let me know through either my contact number or by sending me an email. I'll communicate that information to Flinders University. Flinders University is going to reach out to you and schedule a 15-minute phone interview with you. And after that, you're all done. Once the interview is done, again, Flinders University is going to let me know that they have conducted your interview, and after which I'll coordinate with the accounts. The accounts will reach out to you, ask for your bank informations, and the amount for participating in this survey will be transferred to your account directly. So if there are any questions, this ends my presentation. If there are any questions, now is the time. Please feel free to ask any question. I would encourage you in the session to at least download the app and sign up. So if you feel there is any technical glitch, Yari is here, so we can directly try to address that problem. And if not, then yes, you're all free to go.
There's been no problems with people who have forgotten passwords.
If people forgot their password, there's like a forgot password function where it's basically sent you a link so you can reset your password to the email that you registered with.
Yeah,
it's just like a regular app, and any other app you would forget your password. Yeah, the same process.
So there shouldn't be any issues, not that I have encountered at least.
No, that's good to know.
And it can only be the same thing, like if the return email in worst case can be caught in a spam folder, but that depends on how strict your settings on your clients are. Like it's most normal email clients, it will go through and arrive in your inbox. But sometimes governments and other institutions, they have very strict filters. Yes. One thing that maybe just a small detail, if you saw Atif's presentation, had my picture of my daughter on them. But if you actually want to add a picture of yourself, you click in the circle on the top. Then there's actually an option to add a picture. It's not something that's set, but if you click on this when you sign up and look at your details, you can click on the circle in the left upper corner, and you can add a picture if you like that.
Yes, no, that picture is not there by default. I just have those pictures because those were the initial screenshots you shared.
I know.
All right. So one of the comment is that they got the code, but the code is not working. So probably, Noman, if you could ask the app to resend the code. Maybe there is a time limit and that has expired, and because of that, the code is. All right. No, the code is working. Okay. It's working. Good. It's good.
The time limit is not that short.
Oh, okay. How much is it? Is it 5 minutes, 15 minutes?
No, more, I think like half an hour or something.
Oh, okay. It's the picture. Oh, the code worked. It's the picture that's not being updated.
That does after the reset. That doesn't go that quick.
The comment is that it's actually not by clicking on that button, it's not actually taken to the gallery or anywhere. The button is not functional on the Android.
Which button?
To change your profile picture.
There might be like try click like up or down of the button, because there might be, all depending on what phone and what resolution and what size, then the overlay of the buttons, and the buttons might be distorted.
Right.
A bit, because one thing I found out is some have like a very large text on the phone.
Yeah, it's a Samsung S9.
But try to see if they can click like up or down or like close to the button. But it might be some of the phones found out it can distort it, all depending on not so much on the phone, but also on the resolution. If you have like a very low resolution, to have like very big writing, then it can distort some of it.
Right.
But that I can look into if it's. That's not a function we have tested on all phones. Like all the basic functions we tested on various phones, but the profile picture is.
Yeah,
more.
Mine is S10, and it's actually not working on mine too.
Okay.
Yeah.
But I have a new version of Android that should have been uploaded earlier today, but it didn't get approved yet for some reason. Okay, so no profile pictures for now.
Yeah. Again, Noman, the question is, do we need the feedback now? No, but just let me know as soon as you're ready, and that feedback will then need to be communicated to Flinders University. It will be anonymous, so because of ethics, we cannot know what your feedback is.
Yeah, I think the idea about this session is more if you have technical difficulties, and
Yes.
then make sure that you're up and running, and then Flinders University will be the one actually conducting the interviews and doing the evaluation because of these ethics. So we are not basically allowed to do that.
Exactly. Yeah.
I guess it's so we're impartial. Otherwise, we'd be telling everyone how great it is.
Yes. All right. If there are no other questions, then I will end this session. If you still come across any technical problem, kindly let us know, or Jari know. My email address, Lien's email address, and Yari's email address were mentioned in the start of the presentation. I will email all of you the presentation as well as the link to that YouTube video if you need to listen to it again. Thank you very much from me, Lien, and Jari for attending this session.
Maybe also, like if you have any technical questions, like write me. And sometimes easier to write a phone number also if there's anything, because then it might be easier just to like guide you through and actually talk about if something is teasing. So just write or call if there's any issues.
If you're happy for me to share your email, your phone number, Jari, I can do that.
Yeah, as long as it's like in this group, then fine.
Yeah.
That it might be easier.
Yep, sure. So the phone number is 0402 345 240. I repeat, it's Jari's number. It's 0402 345 240. In case you have any technical problem or glitch, he's our techie guy and he will hopefully address it.
Yeah, sometimes it's quite annoying if you're like trying to write mail and waiting and nothing happens. So if anything is bothering you, let me know.
We have had that experience in the past.
Yep.
Yeah. Yes. Alrighty, everyone. Thank you so much. I'll end the session now. Thank you very much again for attending, for participating in this whole process, and also in participating our evaluation and giving us your feedback to Flinders University when they reach out to you. Much appreciated. All of you, please have a good night.
You too. Thanks, Latif.